All right. Palpitations, pelvis. We're gonna go ASIs first, which is right here, right? Front pelvis, umbilicus, just belly button. McBurney's point, which is on the patient's right side in between, right here. And SI joint, if you have you turn around. Right? Find PSIs, and then it's right here on this side. All right? And then we're gonna do special tests. I'm gonna have you lay on the ground. We don't have a training table, but we're working on it. Scoot up a little bit. Scoot up. There we go. Okay, we're gonna go leg length. True leg length is ASIs, right, to medial malleolus, but functional is umbilicus to medial malleolus, right? Gapping, compression test. Come over, right? We're just gonna push. We're gonna find that pelvis, right? that ASIs, and we're just gonna push down and out. Look for pain in the back, right? Down and out. Gapping, I already did that. Long sit test. Arm sit, right? We're gonna measure malleoluses, and longer to or we're gonna measure, right? Initial, then we're gonna pull, and then put them down. They're the same, so nothing wrong. But if they were to change, or if we were to go longer to short, that's anterior pelvic tilt, and if it were to go from short to long, that's posterior pelvic tilt. Then McBurney's test, real easy. Right, we're testing for appendicitis. We're gonna go to McBurney's point, and we're gonna push down, and then release. And if it hurts on rebound, it's appendicitis. So, yeah, and that's pelvis. All right, we're on our makeshift examination table. Start with palpation of the hip. ASIS, sartorius, or ASIS, right, front of the hip. And then sartorius, which goes from lateral to medial. And then we have rectus femoris, right down the middle. Vastus lateralis is on this lateral side, and vastus medialis goes on the medial side. And then vastus intermedius is underneath rectus femoris, right? It's in the middle of those two, lateralis and medialis. Abductors, right, on the inside, up to through here. PSIS. Boom. Okay. So palpations continued. We go first PSIS, right? Glute max, right? Butt cheek, glute med on your side. Glute med would be right up here, right? And then TFL would be down this way in the middle, right? Or on the other side. And then glute max. Greater trochanter, it's in here. We'd palpate it, or we'd have him rotate his hip, right, and then, or rotate his foot, and then we'd feel that in there. TFL IT band, right, runs down on the lateral side, and hamstrings, right, and iliac crest, which is on that top of that pelvis. And ischial tuberosity, right? That's the bottom of the pelvis. That would be here, right? You go in, and you go up here, and you'll feel it right here on the patient. Boom. And then that's hip palpations. All right, on to special tests for the hip. We're gonna start with hip scoring. All right, we're gonna bring it up. Give me. Thank you. All right. We're gonna come in, we're gonna drive down, and we're gonna rotate internally and externally, right? And we're trying to drive down on the labrum and light it up. Boom. Torque test, we're gonna go in for the femur. We're testing a fracture on the femur, and we're just gonna come down and just drive down. And that's gonna pry the bones apart, right? And it'll light up any fractures. 90-90, straight leg test. This is going to be difficult on our makeshift table, but I'm going to have you scoot up a little bit. Scoot up. And I'm going to have you 90-90s. So we're gonna test for hamstring strength. I'm gonna need you to go up, put your legs up to 90 degrees, like a bend them at 90, yeah, both of them at the same time. And then I'll hold the table so you don't fall. Up here. Out like this, legs up.
Yeah.
And then go straight up, as far, or straight as you can, as straight as you can. Yeah, there we go. And then back down. No. At the knee. So up and down. Okay, and then down. Boom. And then you're testing for hamstring strength. All right, you're good. Okay. All right. Okay. And then we're going for favor test. So we're gonna go figure 4. So put your heel over this, and we're testing for hip mobility. And drop this knee, right? So we have tightness in the hip, but any pain there would be a SI joint involvement. Make sure this hip is down, right? This opposite hip. You're really tight. Happens to the best of us. Sorry. All right, overs test. We're testing for IT band tightness. So we're gonna come up, give me your leg. Yep, thank you. We're gonna come and we're just gonna bring it back and we're gonna drop it, right? Drop it. And if it doesn't drop, it stays up, that's IT band tightness. And then next test, piriformis test. Testing for piriformis syndrome. Scoot over a little bit to the edge of the table, edge of the mattress table thing. And then put this right there. And then we're gonna push down. You're gonna push down, right? And pain with that would be, on a real table, would be laying off the table, but that would be piriformis syndrome. And that's
1. Are we going?
okay. So Thomas test. We're gonna have patient put his PSIS on the back of the table. This would be a long table, but we're working with what we got. And he's gonna drop back and hold his knee right onto your back like that. All right, and we're looking for tightness. So it's this tightness here, either rectus femoris greater than 45 degrees. That's a rectus femoris tightness, and then less than 45 degrees is rectus femoris. Greater is psoas tightness, and then lack of knee flexion, right, would be less than 45 degrees. So patient come up and lift one hip up, and that'll right for 10 seconds, and that'll evaluate glute med strength. So after 10 seconds, if it drops, then that's a negative test. And but if they can hold it and they're strong with it, then no problems at all, and that's huge.